Welcome to the Aesthetic Edit podcast. My name is Mary Robb.
I'm Savannah Salcedo.
We're so excited today because we have a really special guest that's joining us. Before we dive into this episode, can we just catch up for a second? Because it's Friday. And we have had zero time to chat this week.
Extremely minimal. I've been missing you.
I've missed you too. We haven't been doing our voice memos at 5 a.m.
No voice memos. Our Slacks have been very minimal.
We're blowing up right now at social practice. We are in the middle of hiring. We're about to go to next week. Where are we going?
Vegas, baby. I was like, where are we going next week? Vegas, baby. Spa, in case you haven't heard, biggest aesthetic conference in the nation. In Vegas.
Yeah.
We're staying at the Wynn, which is going to be fantastic.
It's fabulous.
This is also my first time in Vegas. I'm really excited.
Wait, you didn't tell me that.
No, this is my first time in Vegas. My family's gone like 3 times without me.
I might die right now. We gotta just cancel the episode.
Well, I know. Cancel episode. We're actually just going to Vegas.
Need to go to Vegas.
Our guest is coming with us.
Oh, yeah. We have to.
I kind of want to now that I'm hearing about it.
Yes, let's go.
But here's the thing. When you're in Vegas, you always have to at least see a show. Like, that's my number one rule.
Absolutely.
Guess where we're going?
Where are we going, Mary?
I might have spilled. It was going to be a surprise.
This is
what's funny. I am notorious for doing this. I overshared on social media last night and you caught me.
So Mary on her story goes, I'm super excited. I'm going to see my favorite artist. I'm going to see Christina Aguilera when we're in Vegas next week. And I was like, I swiped up and I said, girl, do I need to buy tickets?
She was so sweet. I was excited. Like, no, we're going together. We have a table. Christina Aguilera. So I grew up as a singer and ever since I was 5 years old, I memorized her entire stripped album. My mom made me hide it from my dad because she's like, this is inappropriate. I'm like, I don't care. I like it.
No, it's okay.
I memorized every single one of her songs. And like, literally, she is the person that I try my best to sing like.
Yes.
And not to mention, she completely changed the landscape for women. She created this safe space for us to just not only be vulnerable, but be comfortable in our sexuality and it just kind of spiraled into all of these different everything channels for us to be open about ourselves, our bodies, our health.
Yes.
Which
speaking of, this is the episode. This is our Christina Aguilera episode. In case anybody's wondering, we are talking all things women health. We're talking about their sexuality, everything. So I'm so excited for our guest that we have on today. Yeah. Dr. Dharamsi, who's also my dermatologist, one of our clients here at Social Practice. We're welcoming her to talk about everything. And we just want to welcome you to the podcast.
Thank you for being here.
Yes.
Yeah, thank you so much for having me. I can't believe you're introducing me in the same realm as Christina Aguilera.
How do you feel?
I love her. I'm obsessed with her. So I grew up watching the Mickey Mouse Club and I swear I could see her starhood well before anyone else could. I was like, that girl, her and Brittany and Justin and Ryan, those 4, like they're going somewhere. And look, they all are.
They're on fire.
But she's 6 months older than me. And I'm kind of like a geriatric millennial like she is. So like her and Brittany and I are all like the same. We were all born within the same year of each other.
Oh my gosh.
So these are my idols too. So I love that you love her.
Oh, obsessed.
Oh my gosh.
So I do have to just more formally introduce Dr. Dharamsi. She's a board certified dermatologist and she spent her career in such a unique way. She's genuinely passionate about her patients, men and women, but she also is very passionate about women's health and really getting more into the root cause of things that happen in the medical world. And I just can't wait for you to share your story. Can you just tell our audience a little bit more about who you are, your background, where you came from?
Of course. And I haven't had a chance to say thank you so much for inviting me on. This is my first podcast and I'm really excited to be doing this. So thank you. I love you guys and I love having you as a patient.
Yes.
And I feel like I've known you for such a while and I'm so proud of you guys and your business as it's been growing. So congratulations to Social Practice. You guys are killing it and I'm so happy for you. So cheers to you guys. And on my end, what I would say is my story is that I grew up in a really small town called Beeville in South Texas. Shout out to Beeville.
Shout out.
13,000 people and counting. And it's a great community. My parents are still there. And I grew up there where what I would say is in my community, there were only a handful of doctors. We're a pretty underserved community, very different than what we have in Dallas, where there's so many physicians, right? So I lived there for my first 18 years of life. We didn't have a lot of money to travel. we were considered like the wealthy kids in town, but on Frisco standards, we could barely afford an apartment probably, right?
Yeah.
So that's my world.
Yeah.
The nearest shopping mall was like 90 miles away. Just to give you a perspective, we had Walmart and Bells. And if you know how to spell Bells if you know how to pronounce Bells properly, you know you're from South Texas, right? Everyone else has Beals.
Yes.
Exactly.
It's Bells.
So you know it. Do you know?
I do know.
How do you know?
I'm from Plano, but
you know Bells?
We're from Texas. You
Girl,
know,
thank you.
Yes.
Thank you.
Yes.
I get a lot of hate from my husband who's from Georgia. So
he doesn't get it.
Exactly. He totally doesn't get it.
We love you.
So where I grew up, there weren't a lot of doctors. And my personal story was, I now understand part of why I had a lot of health struggles myself growing up. I now understand that I was in a pretty traumatic accident when I was a toddler. And back then, where especially, back in the 80s, where there not only was there a different level of access to care in my community, but there was also a different culture about how often you take your kids to the doctor. I had this sort of freak traumatic accident as a baby, which I now understand is a big root cause for a lot of the strange, weird symptoms that as a young kid I grew up with. And, I'm in a town where we didn't really go to the doctor a lot. And there were a lot of things that I was experiencing in terms of like chronic pain and migraines and headaches and pelvic floor pain related to some of the trauma that I went through. And all sorts of symptoms that I felt like were kind of ignored, not by any purpose, but just because that's how things were. And so I think when you grow up in that environment where you're suffering quietly, you just see the world really differently than now as an adult. I recognize that's kind of different how most people see things. I also grew up as a minority. By far, the population where I grew up was Mexican American, and it's such a beautiful culture. And I wanted so much to be part of that, but I don't look like the vibe that I grew up in, right? So like there was a lot of prejudice and stuff that I struggle with too. And I got bullied a little bit, and it has definitely affected me in ways that I think are for the best, because I now really feel like I have such a honest, genuine compassion for people that are quietly suffering, and maybe people that don't have access to good care, and maybe people who have been gaslit by the medical community when they go to the doctor and they're dismissed for things that maybe don't make sense to the doctor, but yet are still real for them. So in my own personal journey, I think I have really come to this place now where, having been in practice now for 12 years since I graduated my training, I feel like I'm at this point where I really know who I am and I know how I want to practice. And my big picture is I love being a dermatologist, but it's a little hard for me to stay in my quote unquote lane, because the lane is defined by this like Western medical model that is great in its own way, but it's also limited in its own way. And if we only stay in our silos, like if I only practice dermatology and if everyone else only practices in their lane, we're going to have a really hard time missing the thing that might integrate it all together. And so I'm really passionate, and I've spent my time and energy and focus and free time and fellowship training on being more of an integrative provider, which means, and what does that really mean? I did a whole fellowship on integrative dermatology. That means acknowledging that I don't know it all. Who else might know more than me that's looking at the same disease from a different perspective? So what does the chiropractor have to say? What does the Ayurvedic doctor have to say? What does the Chinese medicine doctor and the acupuncturist and the physical therapist and the other specialties of medicine, what do we have to say about the same issues? So that's my standpoint and where I come from in my background.
Did you struggle finding what specialty you were feeling called to? Because it sounds like you have a passion for all of those areas.
I did. And in going through med school, so I told you I'm from a really small town, and I'm blessed enough that I got a scholarship to go to Vanderbilt. And I'm so blessed to have been there. And I met my husband there. And then I ended up blessed enough to get into Johns Hopkins Med School, which is such an incredible institution. It's actually where the modern practice of medicine was sort of founded. And it was like in the 1890s, right? So we're only 130 years into it. And back then I was like all about science. I'm like a science geek, and history was not my interest. But now as a grown up, I'm becoming more aware of how important history matters so much, especially as a woman. And I'm so blessed to have been trained at this amazing institution. And one thing I love about Johns Hopkins is what a prestigious place it is.
Yeah.
And what a foundational place in sort of the history of medicine, how it was developed. But I also recognize now, and I can only see it now from my perspective, that back then when that was founded, it was only men who were admitted to med school. It wasn't until 1920 that women were allowed. And it's only now, I mean, what is it, 2024? Only for the past like maybe 5 to 10 years, I believe. And I may be misquoting and hoping I'm sorry if I'm misquoting data. But women are just now making up 50 to even more than 50% of all medical students.
Yeah.
So women have just barely had a seat at the table as doctors. And I love men, and I'm grateful for all the men that founded medical education. And I also recognize now, just sort of looking at it in retrospect, that, men, like when we look at what we know the most about in Western healthcare, we know a lot about things that affect men. And for better or for worse, when you're a doctor, you want to study and research things that affect you, right? So we know a whole lot about heart disease and cancer and diabetes and obesity and prostate cancer and erectile dysfunction and all these things that affect men, and good for them. And that's amazing. And now what I would say is, like, I feel so grateful upon the handful of generations of women physicians that I'm like sort of standing upon their shoulders. I love that it's 2024 and we're at this phase where I'm so blessed to have a seat at the table. And I will say, as I grow older, I'm passionate about studying the stuff that's affecting me and my girlfriends and my patients, because I feel like as a woman, we're really lagging 100 and something years behind what our needs are.
Yeah.
So that's kind of where my passions lie.
I love that.
To learn more about the Aesthetic Edit podcast, follow us on social media at the Aesthetic Edit podcast. We can be found on Instagram, TikTok, and YouTube.
We'd love to hear from you if you have show ideas or guest recommendations for our future podcast episodes. I love that you have this story of you went through something growing up and you felt a little bit underserved in some ways, and not intentionally by any means, but you took that, and instead of allowing yourself to be a victim and just, settling for the answers you were getting, you sound like you're a lifelong learner. You're very curious. Oh,
yeah.
And you're confident.
Obnoxiously so, I just can't help it.
But it's we need people like you in this world, because you are someone who is going to be innovative and you're going to bring new ideas and new solutions to the table, which is what I really want to talk about, is based on this experience that you had growing up, based on this phenomenal education you had access to.
Right.
You now, though, have this new perspective. We were just talking about some new things that you've learned. How are you integrating what you know now into your practice, and where do you see the future of your practice going with all these different experiences that you've had so far?
Yeah, I think that's a great question. I chose dermatology in part. I loved everything in med school. Every rotation I did, I was like, oh my gosh, I want to be a pediatrician now. And then like 6 weeks later, it'd be general surgery. Oh my gosh, I'm going to be a general surgeon. And then it was like, I'm going to be an internal medicine doctor. And oh my gosh, I'm going to be a psychiatrist. And I'm going to be a neurologist. And I just was that girl that I was just so eager and grateful for the opportunity to be in a school. And I'm so intellectually curious by nature that I had a bit of a hard time discovering which field to go into. But ultimately, I know that, God really led me to derm in so many easy ways that I look back and it's so clear that this is what I'm supposed to be doing.
Yeah.
But I love dermatology because it gives me the chance to treat people of all ages, all backgrounds, all demographics. I get to do surgery. I get to do cosmetic. I get to do medical. And I get to really treat the whole person, because if you think about it, our skin is just so cool. And yet it's also the only part of our body that we can see. We can see it.
Yeah.
We can see as a dermatologist, I'm a generalist. So my vibe, so some dermatologists just specialize in one thing. Like they just do surgery. They just do cosmetic. They just do acne or whatever. They subspecialize. And usually those people like work for universities. I consider that, but my vibe is that I want to be like if you put me in a small town, I want everyone to get their answers from me. That feels important to me. And only now am I really getting, it's so funny how you stumble your way into your calling. I don't know if you can relate to this.
Absolutely.
And then when you get a little older, you're like, that's so cool how my past like led to where I am.
Yes.
So
good.
I know I'm where I'm meant to be. And if I can't help it, I'm feeling called to tell this. So I'm someone who I'm grateful. I kind of found my faith really young. And my understanding of Jesus and who he was has really evolved over time. And but what I will say is something that struck me is that Jesus, his first miracle was that he laid his hands on the hands of a leper.
Yeah.
And the leper was like, "Oh my gosh, you're touching me," even though, you know, and I think with skin disease, it's such a stigma. It's such a personal thing. There's so much of like a physical and emotional and psychological burden to our skin. And the fact that I now get to go into clinic every day and I purposely don't wear gloves because 99% of our skin diseases, they're not contagious, but people don't know. And it's amazing how many like tears trickled on people's faces when all I do is touch them without gloves because everyone's been afraid of them.
They have this like level of embarrassment around
of course,
it, so they don't
and
feel comfortable.
Deep shame. So to me, I think as I went through school, it's now very clear that like this is where I'm called to be. So I guess what I would say is I'm someone that had a calling to like seek medicine that was like more emotional and spiritual and intuitive. And but also I'm very intellectually curious and I'm graced with a brain that can ace tests, which thank God, because it's really hard to get into dermatology. It's so hard in America. But all I can say is I'm really grateful to be in the position I am, to now be able to take all of this sort of intuitive desire to learn with this incredible education that I'm so grateful for, but now kind of take it all with a grain of salt. And what I'm realizing is I'm 12 years out of school. And when you're in school, you want to cater to what they want you to say and do to get into school and be good enough to be the person and whatever. And it's so hard to become a derm. And I love that I'm a dermatologist, but I can say that after 12 years, I can also be really honest about who I am and how I can now reintegrate into how do I take this world-class education and bring it back to the fact that I'm a small town girl and I'm a patient myself and I've been suffering for a really long time. And there are answers that I still don't have, in part because, you know, I have things that doctors haven't figured out yet going on in my health, and in part because I'm a woman. And the truth is that until enough women have been doctors long enough, there aren't going to be answers for us. So what I'm realizing is in the same way that the male doctors back, 175 years ago, they were studying things that affected them because it matters to them. My personal journey has been as a woman, I've had a lot of issues, just to be really honest with you, growing up with related to like vulvar and vaginal health, then related to fertility issues, then related to postpartum issues, especially after having a C-section. And the doctors are like, okay, bye, peace out. And you're like, is this okay? I just had a major surgery, and like, you'll be fine.
Yeah.
Right. Yeah. And then it's just, don't even get me started on hormonal acne, which I see so many adult women come in and no one tells us about this. But why is that? I feel like as women, we're just kind of like navigating blindly. And one person at a time, I'm saying like, hey girl, I know exactly what you're going through. Let me help you. Yeah. But like, why am I the only one doing this right now?
Yeah. It's 2024, and I think it's finally time that we stop being dismissive of women's health. And I can speak from experience.
Well, preach.
Yeah. When I was 26 years old, I've been going to my OBGYN since I was 16, every year, standard exam. Been on the birth control pill because that apparently helps with cramps and cysts, all the things. I get my annual physical checkup and they say, oh, there's a softball sized cyst in your ovary. If we don't remove it immediately, it might knock out one of your ovaries, which would drastically decrease your chance of being able to have babies one day. So I was rushed to Baylor Hospital in Dallas within 2 weeks, got it surgically removed. Everything's okay. But it was just one of those moments where I looked at my doctor and I said, you know what? You told me that being on this birth control pill prevents cysts. So in my head, I'm thinking we're good. And she's like, yeah, we just don't really know. And I'm like, how is that an acceptable answer? And she was totally comfortable saying that to me. How is that an acceptable answer? And it's one of those things. I was 26. Like, what are you going to do? You just use your insurance, you go to the hospital, and you're done. And to this day, it's
26. That's hard.
But it's just, that's been my experience with women's health my entire life.
Right.
So how do what do we do about this? What's been your experience?
First of all, I'm sorry that happened to you.
Thank you.
Sometimes I feel like I sort of apologize on behalf of our healthcare system just a little bit, because I know that all of us have sometimes had encounters with not so great doctors or providers. And there are some amazing doctors out there, and PAs and nurse practitioners and providers all across the spectrum. We're so grateful for their care, but there's also some really bad ones too. And I've personally been part of experiencing that. And it makes you distrust. And I will say, especially as a woman, and again, I was kind of getting back to it. Like, I love men. I have an amazing husband. I'm a mother of a wonderful son. Half my employees are male. My best friend is a guy. Like, I love guys. And the truth is, if you really look at history, women are just getting a seat at the table. And it's really up to me and my generation to start talking about these things, because if no one has until now, am I just going to sit here till someone does? Like, no, I'm not. I'm going to beat the change, because I know that it's very lucky that I get to have this platform. 50 years ago, who the hell would have a podcast with women on it, for God's sakes? And now look at us. Like, I feel like it's a great time to be a woman. It's a great time to be a doctor. And, my parents always told me, to whom much has been given, much is expected. And I take that really seriously. I know I'm standing on the shoulders of a lot of amazing doctors, both male and female, but especially women pioneers that allowed me to get a seat at the table. So to your exact point, women's issues haven't been well studied because there haven't been enough women in power for enough time to start doing the studies. And Western medicine, for whatever it is, I love it, but it's limited because they define what's acceptable based off of what's been studied. And it takes a lot of money, especially now, to do these studies. And it takes a lot of interest and time and effort. Well, shoot, I'm in the clinic loving on my patients. I don't have time to do all that. As are most women. But I will say, women bring this whole other mindset and heart and mind, body, soul, like vibe to medicine, which I think is what's been missing in the Western medical model. And I'm not sure that the Western model knows what to do with women like me. Do you know what I mean? Who have a heart for bringing more of a holistic approach and really also bringing light issues that affect women. Like hormonal acne, like cysts, like postpartum issues, like what happens after a breast augmentation. I can wax poetic. What else?
Well, you're reminding me of the conversation we had about being an Enneagram 8. You sound like you're a challenger. Wouldn't you agree?
Yes. Well, have you taken the
I'm
Enneagram
a 7-wing 8.
Oh my gosh.
Totally.
I love this. We're just bringing all kinds of 8s.
Love it. Love it.
So you're curious and you want to question the status quo.
I do.
And so what are some of the things that you're seeing in your practice today, and how are you helping patients in a way that's different than how you were traditionally trained at the universities and the education you had?
Thank you for asking me that. I love that no one's ever asked me that, but I'm doing a lot of things a little untraditionally. And for a while, I was scared about telling anyone, because I'm like, I'm not being like the textbook. Is that okay? But like, I've been doing this long enough to know that like people are getting better and they love it, and they're telling all their friends. So I'm like, I must be doing something right. So praise God, if I can take anything from all this, it's just like, trust your intuition. It doesn't matter what training you went through. Like, at the end of the day, it's all about you and your intuition. And as I get to integrate my wonderful education with my intuitive style and all of this history, some of the things that I really enjoy treating, for example, are issues that affect women, particularly like vulvar issues. So the vulva is the outer part of the vagina, right? And when I went through med school for a little while, I really thought I was going to be an OBGYN. And I've always had passion for that part of the women's body, because it's not a place that you can really talk much about. It's a very sacred space to have that connection with your doctor to speak about your intimate parts, right? But what I learned when I went through school was that when it comes to the external part of the female genitalia, which is the vulva, no one really owns it. It's what we call an orphan area. So the dermatologists think the OBGYNs are going to handle that. And the OBGYNs think that the dermatologists are handling that. And none of us are really handling it.
Wow.
So it's funny, I went through training and we didn't have a lot of training on genital health. And I kept getting these patients and I felt very passionate about trying to help them. There's all sorts of autoimmune and irritant. There's all sorts of things that can affect women and men's health for that reason. But back in residency, I found myself really gravitating towards those patients to the point that they started calling me Dr. Genitalia.
Oh my gosh.
What a title,
Dr. Jenny. I became Dr. Genitalia for a little while.
So funny.
But legit, when they started calling me that, it was like my first or second year into school. And I was like, is this what I'm supposed to do? Like, maybe this is important. And the more I really did my research and looked around, I was like, no one's taking ownership of this. So I actually spent a little extra time and I did this fellowship with this amazing dermatologist named Libby Edwards in North Carolina, where I learned even more about medical and like medical issues that can affect the vulvar area. And I have so many patients now that I'm able to help just because there's no one else in the whole freaking Metroplex that can help them.
Yeah.
Like, how is that I'm the only one only because I cared a little bit enough to do a week of a fellowship?
Yeah.
Right?
Yeah.
And I can go on about women's hair loss, adult female acne, postpartum changes. There's just so many other pieces of what I'm referring to when it comes to neglect and sort of lack of general education for women about things that we know we're going to be affected by.
I know you said that you did the fellowship. What if we have providers that are listening that want to take that next step to be able to kind of take ownership of that orphan area that people are kind of afraid or they aren't sure if they should be the ones that are treating it? What kind of education can they do since you are such a lifelong learner?
Right. So all I did was go to meetings and meet smart people who were speaking on a podium about interesting things and go up afterwards and say, hey, I'm so curious about this. Can I come shadow you for a week? It's so simple.
Oh.
I quote unquote, I call it this fellowship. It was just a week. All I did was go for a week. But with that week, I've now have 12 years of treating my community. And I don't know where they would have gone if they hadn't found me. There's a couple others at UT Southwestern. I'm so glad. I trained at Southwestern.
Yeah.
And they didn't have this there then, but they do have it now. Shout out to Dr. Mascars because I hear she's great. Oh. But between her and myself all the way up in Frisco Prosper, there's only a handful of us that are addressing this issue that affects so many people. And it's amazing how many full body skin checks I'll do. And while I'm there, I'm like, hey, I know you didn't like take your panties off, but like, is there anything going on for you in your vulva or vaginal area? And I would say at least 1 out of 5 people says yes to that.
Okay.
And it's only because I asked. They didn't know. And they're like, oh, you do that? I thought my gynecologist, or I've brought it up to my gyne and my gyne said it's fine.
Yeah.
So it's just,
you're creating that safe space for them where they feel that they can be heard.
For sure.
Which is something that's so important for such an intimate area.
Because if I don't do it, who's going to do it?
Exactly.
Yeah. Right?
Exactly.
And there's unfortunately still to this day a lot of shame around this subject, around aesthetics in general. It's genuinely one of the missions of this show is to
which I love.
Eliminate shame completely about these topics because it's real life. So
it is. 50% of all humans that are alive today have a vulva and a vagina.
True.
That is an organ that's honestly, can we just be real? It's a whole lot to live with, y'all. It's a whole situation. I'm raising an 11-year-old daughter. It's like a whole thing. And there's not a freaking handbook.
No.
So I find myself, and again, I mentioned like I'm raising this preteen and I treat a lot of adolescents and I treat I treat everything. So I don't just treat, I'm not just Dr. Genitalia. I'm a head to toe doctor and I do Mohs and Mohs closures and cosmetics and all that. But I treat a lot of young women and it's amazing how we're sort of kept quiet until we know that there's an opportunity where we might feel safe enough to discuss it. And it's just crazy how I would say that at least 80% of the vulvar patients that I treat now, I had to ask them to share with me how much they were suffering. And only when I asked and made a safe space did they tell me. And when I saw how bad it was so sad to see that they were struggling and suffering quietly for sometimes 5, 10, 15, 20, 40 years.
Wow.
That's awful. To connect with today's guest, Dr. Jennifer Dharamsi, visit her website at legacydermatology.com.
And follow her on Instagram at legacydermskin.
Well, here's what I'm very curious about for both providers and patients is what are the procedures and the treatments that you're offering right now that are changing people's lives that maybe not everyone knows about yet?
Educate everybody.
Great. We want to hear about this.
Okay, so a few things. So I'll start by kind of talking about this like vulvar and sexual health piece, right?
Yeah.
So women for so long have been really silent and quiet and prim and proper and shamed about, our lady parts and our sexual health. So I have found that because of my specific interest in that, and because I've found that I have developed this rapport where there are a lot of women that do have this trust in me, that my career has sort of evolved, at least a subsegment has been talking about sexual health and wellness. And especially myself as someone who's been in a really long relationship. I married my college sweetheart. We've been together for 21 years. And
congratulations.
We celebrated 16 years together. Let me free.
Oh my goodness.
But let's be real. I mean, sexual health matters to the longevity of a relationship, right?
Yeah.
And there's so many women who, when you really take a second to ask them, there's so many women, even in you wouldn't imagine how many people answer this question when I say, so do you have pain during sex? Yeah, most times. Have you ever had an orgasm? I don't think so.
Yeah.
So many people, especially our older generations.
Yeah.
And so one of my favorite things, so we have an amazing laser center that my husband runs. And part of the overhead of running a laser center is some of these lasers have a lot of additional hand pieces that you can bring aboard to the platform. So one of the hand pieces we brought aboard is the Diva. The Diva is this thing that has been so life-changing for my patients and quite honestly for myself, because it basically is just a whole refresher to the vaginal area.
Wow.
So especially for folks, as we get older, our estrogen levels decline, and the estrogen is needed to support enough blood flow, enough nerve sensation, and enough mucosal secretion for the vaginal canal.
Okay.
Yeah.
Also, as we get older, all of our musculature gets a little more floppy and loosey-goosey, if you will, especially if you push some babies out. Right?
That'll do it.
And live long enough.
Yeah.
So what's cool about the Diva is it's very comfortable to be done. It just kind of goes inside the vaginal area and it does a resurfacing, almost like a little corkscrew with 2 different wavelengths. One resurfaces the lining itself. So you get more blood flow, more sensation, more lubrication. Maybe you've never had certain types of orgasms that you can now have after one session.
Is this good for women that have had babies and those who haven't?
Correct.
Everybody.
Pretty much everybody.
Wow.
And the thing is the more experience I get with this clinically, my 20-year-olds love it. My 30-year-olds love it. My 40-year-olds love it. My 50, 60, 70, 80-year-olds love it for different reasons.
Yeah.
So there's the resurfacing laser, which is good for us young folks who the truth is we want better sex. And why not?
Yeah. Why not?
Okay.
Yeah.
So I went there and I said it.
Yes.
Sorry. Sex is great. And I'm a girl and I like it and I want it and I'm married and more power to me, right?
Seriously.
And the second wavelength tightens all that shit up, girl.
So do we have it right now? Can we bring it in and we'll go on a commercial break and we'll come back?
We'll do a live demonstration, guys. Don't worry.
We gotta go, guys.
Gotta go.
Social Practice would love to offer your practice a free social media audit. Visit us on social media at Social Practice US. Click the link in our bio to claim your free audit today.
Yeah, so this is my favorite thing for women. It's got, if you go on Real Self, I think it's got like a 96% approval rating.
Wow.
My patient rating is like 100.
Wow.
Every girl, what I always tell people is 1 is better than none.
Okay.
A series is better than 1.
Okay.
And you'll never regret it. And there's like no doubt. It's like 48 hours of no doubt.
Don't do anything.
Like, don't do it. Don't put a tampon in kind of vibe.
Yeah.
And then everything gets better. Just
Is there
trust me.
anybody who wouldn't be a good candidate? It sounds like everybody would be a good candidate for this.
If you are, come to me. Let me assess that. But
The only thing is you have to have a vagina, clearly.
Pretty much.
Then you're good.
Yeah, pretty much.
That's the only indicator.
Exactly. Yes. So I love the Diva, and I love that it gives me kind of this segue tool where I can talk about women's health. And it's so amazing that I happen to be the one, just because I have this passion for it, that I'm the first person that someone has ever been able to talk to about this.
Yeah.
And to me, I feel both like humbled and grateful to be that privileged person that gets to have that conversation, but also kind of sad.
Yeah.
And I feel
You're like, why were you neglected for as long as you were? Why did you feel
just
dismissed?
like I was?
Yes.
Just like I was. Because to be totally honest with you, so as an adult and as a dermatologist, I now understand that I have a subtle form of atopic dermatitis where I have really sensitive skin, but it's subtle enough that it's only in certain areas. And for me, it was in my panty area.
Okay.
And it was itchy and uncomfortable. And my mom told me I just need to clean better.
Yeah.
And so you clean and scrub, and that actually only makes it worse. And how many little girls do I now see where thank God their parents brought them to me? I'm just so glad I'm there.
Yeah.
Because their moms are doing their best, just like my mom was.
Yeah.
But sometimes you just need a professional.
Yeah.
So Dr. Genitalia. I can't say that with a straight face. I love
know.
it, though.
I can't
It's my
believe I
favorite
told you
thing ever.
that.
I'm going to start calling you that. All of our
love
calls
it.
moving forward, Dr. Genitalia.
That's totally fine.
Signing my emails off like that. I think personally, because I can just relate, and I'm gaining so much experience and just love for you even deeper from this podcast episode, just because I am one of your patients. You've helped me in so many different areas. And I think something that's really cool, and I want the audience to know, is that you are not just treating one certain thing. You're not just limiting yourself to the skin. You're not just limiting yourself to one area or one symptom. You're treating people with the true, or for their true root issue that they're experiencing.
Yeah.
And I've reached out to you for limitless things. I've reached out to you for what I thought was eczema and dandruff for the longest time, and it was psoriasis.
Right.
We figured out what the root issue of that was
Exactly.
revolving around my diet. I reached out to you
So
for
cool.
hormonal acne after I had stopped taking the pill for 10 plus years, because again, that's what everybody's prescribed.
Of course, which
nowadays.
by the way, I don't think is a great thing.
I think it's the answer to every problem.
That-
yeah,
a separate podcast.
Next time.
Right.
And I come to you for my Botox, cosmetic needs, like
Love that.
everything. And so I'm like, the fact
Thank you for
that-
trusting me.
Yes,
It means
thank
a
you
lot.
for making me feel like I can trust you. Like, it's
course.
the most incredible thing.
You're my
But I-
ideal patient.
Yes.
Honestly.
Oh, thank you.
Thanks.
I just want to bring attention to the fact that you're treating so many different areas. And I know I'm not even coming to you for all of the things that you do treat. So do you mind educating the audience on just kind of some of a rapid fire of what all you can treat?
So big picture. So I have this great education. I also have my own life experience and intuition. And I've been a lifelong patient myself who maybe didn't get the kind of care that I've always been seeking. So putting all that together, the way that I practice is it's just very personalized. It's very much meeting people where they are. And what's great about being a skin doctor is we are pediatricians, we are internists, we're kind of surgeons, we're kind of endocrinologists, we're kind of neurologists and psychologists, because the skin is our biggest organ. It coats all of us. It's everything that we can see. Our skin, hair, and nails are the window to our mind, body, and soul. And so to really be a really great dermatologist, you want to treat the whole person. And in particular, some of the things that I find are issues that affect women in ways where they come to me and they're so bewildered, and I hate that they are, because nothing prepares you in the world for this. So perfect example, a lot of women get to their mid 30s, early 40s, sometimes earlier, a little later, and all of a sudden they're like, oh my gosh, I've never really had bad acne and I'm breaking out like a crazy person. It's like all along in here. And I'm like, yes, no one warned us, but all women go through this, which is a phase where our ovaries are making less estrogen, but our adrenals are still making plenty of testosterone. The lab results might not show any abnormality, but clinically, when that testosterone binds to a dude when he's 16, he gets a beard. When it binds to us when we're 32, we get freaking cystic acne.
Wow.
Right?
Thank you for the heads up.
Look how you both were like, wow. Why is it that y'all didn't know that?
No one knows that.
Okay, it happens to everybody.
That's
Do
good
you
to
know how many people a day I'm personally like giving them info that they don't know, and all they are is just a girl in the world, right?
Just
Gwen
girlies.
Stefani, right? Like
Just living.
I'm just a girl in the world, right?
That's the culture, you know.
Right, it is. So female acne is an issue. Women's hair loss. Oh my gosh, how much of that do I treat? And there's so much that we can do to prevent and protect against that. I briefly mentioned a little bit about postpartum changes and how, I will share briefly that I went through my own share of fertility struggles and had, unfortunately, a lot of miscarriages, and then went through fertility treatment and had complicated C-sections. And I'm still recovering for some of the post-operative changes that happened that The doctor was, I love my doctor. He's amazing. But it's like, good job. The baby's alive. Okay, bye.
Scar
See you
looks
when you-
great.
Bye.
Yeah.
Scar looks great. Bye.
Yeah.
And I'm like, okay, I think I'll go back to 24-hour fitness and like keep doing all these exercises. And then, you know, I'll be like really transparent about this. So like after second baby, my girls were a little like not there anymore.
Yeah.
Especially because I'm working out all this extra.
Yeah.
So, you know, when a lot of women get breast augmentations, what so many people do, y'all, surgeons are amazing at doing surgeries, but managing the scars that happen afterwards, it's just, it's not their fault, but they're not trained or educated on how to do that. And as a derm, I treat scars as part of my job, and I live with scars that are deep in my body as part of my own journey.
Yeah.
And what I have to tell you is after a C-section and a breast aug on top of a childhood injury, that's not okay for the body to go through without some physical therapy and rehabilitation.
Yeah.
And I've really had to fight very hard to get back to where I can't even practice medicine anymore. I had to go out on disability, and my amazing patients have put up with a lot with me for the past 4 years. Being in and out, especially when you compound with long COVID that happened on top of it.
Yeah.
So my point being is, I know I'm not the only one who is dealing with this kind of challenge. And every day I meet more and more people who are.
Yeah.
And what I try to do is I help where I can, and then I network and connect people to people who I have found that have been helpful to me.
Yeah.
So I'm doing my part to get integrative as much as I can. And if I can't solve their problem, I'll help them find someone who can.
Yeah. This is so good because what I love about what we do is we're looking at this from two angles, because our culture, social media influences the information that we have access to and the stories that we're telling.
Totally.
And going back to our Christina Aguilera conversation, you know, we've watched the evolution of how the celebrities and the culture influence women's, you know, mental health, physical health, the things that we know about. So with social media in mind, you know, you have done a great job at sharing your story and educating and putting things out there. But how do you feel about doctors and people in the healthcare industry in general? What is their responsibility to share these things that you know and that you're learning and these experiences? And how do you feel like social media is influencing the industry and our future of women's health?
Wow. Well, I love that question. And I guess what I would say is, again, I was blessed enough to train in this very traditional system. So I took that very seriously, which is that, you know, look at the studies. What does the evidence show? Where's the data?
Yeah.
Well, when you flash forward enough and realize to do the study, it takes money. And some things don't have the money and the influence behind them, but it doesn't mean that it's not still possibly true just because it hasn't been studied.
Yeah.
Right. So what I'm loving about social media right now is it's almost like this whole new way of learning. So I'm on a group with a bunch of board certified dermatologists. And instead of me taking the time to publish a case report in a study in a journal for free and spend hours on that, I can just go online and be like, check out this cool case. What do y'all think? And they're like, that's awesome. I've seen that before. And that's so cool. And we're kind of learning more in real time from each other. So as an aside, I think social media, for all its pros and cons, it's allowing doctors to share knowledge. It's allowing us to learn way faster than the stupid medical journals can keep up.
Yeah.
And to that effect, I do see more and more of my colleagues. I have so many friends who are like putting themselves out there on social media and educating and teaching. And I'm super proud of them, and I may join them if I get the courage, because I think it's great. So in the same way that I'm saying, why is it that women don't know that this is going to happen to them? I have 20 other things I could say about this. Like, hey, every human, this is what it's like to have skin.
Yeah.
You know, I think that being alive is hard enough. Do you know what I mean?
Yeah. Being a woman's difficult.
Being a woman, but just being a human, just being a person in a body and figuring out, like, is this new growth going to kill me, or is this new growth just a birthday spot, right?
Well, and y'all have so much wisdom from all of the education that you go through. Why not share it with the world in case somebody's going to somebody that maybe isn't giving them the information that you could?
Exactly.
Why not get your education out there, build yourself as a key opinion leader in the industry?
Sure. And the thing is there are so many amazing doctors and providers out there, but there are also some that aren't. And I think that what I get worried about is, unfortunately, I've worked with some patients that are really disillusioned by doctors and they don't trust us. And I honestly don't blame them. And I want that to change, and I want to kind of be part of that change. I want people to know that, like, you can have an MD behind your name and still be a human and a person that cares about the whole body.
Yeah.
And, hopefully that still, is a valuable asset for the future. We'll see. The healthcare is changing beneath our feet, but I just hope that we can continue to survive and thrive in our area because we really love it.
And I feel like in addition to you sharing your education, another way that you can help those people that maybe have that perspective on providers is by sharing client testimonials on your social media.
Sure.
And y'all,
which we have been. And y'all have done such a great job of highlighting that. Thank you.
Of course. No, and it's great. And I tell everybody that I know, I recommend you to everybody who needs a new
Oh, really?
My mom is going to be reaching out to you. I actually give her your number.
Thank you. Yes. I love that.
No, and I tell people even in our company, y'all's testimonials that you get from patients are the most intentional and personal testimonials.
Oh, thank you. I'm glad
it's
to hear
incredible.
that.
Like there are people that talk about the necklace story. I want everybody who's listening to go listen to your social media testimonials on your page. But there are some where it's like you gave somebody who was really struggling with stuff on their chest and you gave them a necklace once they were finally able to get through it because they couldn't wear necklaces for the longest time. Yep. You have somebody who comes in and builds you a gingerbread house for you and your husband every year. Like,
so amazing.
It's just, it shows how much you are prioritizing the patient.
Thank you.
And it truly is the most incredible thing ever.
am. When I opened my practice, I'm blessed enough to have a husband who supports me in this. But when I decided to leave being, someone who worked for other practices and come out and do my own thing is I just said, I just want to be a doctor first and let the money come. Mm-hmm. I don't want to cut costs. I don't want to buy the cheap sutures. I don't want to underpay my staff. I want everybody to have health insurance who works here. Yeah. What if we created this society where we could give patients enough time? They get plenty of time instead of 5 minutes. And what's great is like, we built this and we're 7 years in and we're still around and times aren't easy, but we're still afloat. And we're just grateful that we still have the support of our community. Yeah. And I'm grateful that my husband still can pay the bills, even though we probably aren't the richest dermatologist in town. I know that I sleep the best at night and I'm so gratified by what I do.
Yes. We love that. And, just to kind of wrap this up, I do think that with everything that's been going on in the past 4 years, we've all just been awakened to a lot of unfortunate truths of what's been going on in this world. And I do think that what Savannah was saying about patient testimonials, understanding what that patient experience looks like. That's how we're shopping these days. We're looking for an experience and we're being a lot more selective with the providers that we're choosing to go to. And so social media has allowed you to start to tell that story. And
yes. And to that exact point, I'd love to just mention an anecdote. So I saw a patient yesterday and he's a guy that I haven't seen in about a year, but I really respect him. He's a businessman, a financial planner in Frisco. And he was like, by the way, I've been loving your social media. It's really great. And I said, well, we're just getting started and we haven't gotten that many followers yet, but we're excited. And he was like, no, because you know what it does? It gives brand recognition because people are proud to see their dermatologist. They may not like it or comment it, but they still feel good about like how nice of a thing you said online, or like they're proud of what you're putting out there. Yeah. And if anything, we went a long time without a big social media presence. And I'm really proud of what I've been able to create through you guys because it feels like it legitimizes a lot of what we do. We care a lot about giving high quality care. And when you're in person with us, we make a point to have a beautiful building and a great vibe. But the world is changing. And if you don't have an online presence, you don't have anything. Yeah. And so y'all have really helped us kind of go from like I couldn't be so proud to like I couldn't be more proud. And so thank you for all of that. You guys are incredible. And I'm so proud of all the growth that you've done. I just love both of you. So
we love you.
Thank you.
Well, we're going to wrap today's show, but I will say we definitely want you back because I know that we're about to make some pivots and we want to bring you back and share with the audience what that's going to look like in the next year.
Yes. Okay.
And we're really, really excited for your growth. And we just so appreciate you for taking the time to share your story.
Thank you so much for having me.
Yeah.
I hope I didn't talk too much.
You didn't.
My God. You didn't. No, that's why we're having you again, because there's more to talk about.
Yeah. Well, thank you for that. Thank you for indulging me. This was so much fun.
Of course.
Y'all are great.
And now we're going to go get the Diva treatment. So see y'all later.
You will not regret it.
I promise. Bye, guys.
You can find us on social media at the Aesthetic Edit Podcast.
We're on all podcast platforms, so don't forget to subscribe, and we'd love to hear from you.
And follow Social Practice on social media. You can find us at Social Practice US.
If you'd like to become a guest on the podcast, visit our webpage at social-practicetx.com/the-aesthetic-edit.